morning, everybody. This is John Mangiaratti, your town manager, and thank you for listening and watching today's Java with John program. We have some great guests as usual this morning, and we're going to have a great conversation, and then we'll have time for any questions or questions from the public. This Java with John program is a former senior center program that we've now taken virtual, and we're doing it every week, and we're getting a lot of great conversations, and today will not disappoint. So we're listening on 94.9 FM. We're also live on YouTube. If you have questions that you want to ask our speakers or ask of me, you can call 978-929-6611. You can also send an email to manager@actonma.gov. So here we are, it's Friday, May 15th. Town buildings and schools have been closed for 2 months now. So it's really become a very different situation that we're all living in. Earlier this week, the governor announced a 4-phase reopening plan for the Commonwealth. Some other states nearby, such as Rhode Island, have already entered early phases of reopening, and we expect on Monday the governor will announce his plans for how we are going to approach as a Commonwealth reintroducing certain parts of our life and our economy. So we're watching that very closely. We're also doing a lot of planning internally in our organization to try to understand what different phases will look like as we start to introduce more services back to the public. And we're going to be making some announcements next week as well, depending on what we hear on Monday. We have, for all of you that are at home, hopefully you received the Municipal Monthly in your mailbox last week, and it's got some great resources in here for things that you need to know and resources that you can find about COVID-19 and how to get help if you need help. Also of note is on the back page is a mail-in voter application, which our town clerk will be talking more about later, but I want to make sure that you have that and send it in if you're looking for one. So with every week, we have an update on public health. We have our director of the Acton Nursing Services here, Heather York. Heather's been doing a great job over the last few months in contact tracing and helping us all understand how to handle this pandemic. And she's has some updates for us this morning. Good morning, Heather. How you doing? Are you ready for your update?
Good morning, John. Good morning, everyone. So as John mentioned, the governor rolled out a 4-phased reopening that potentially will start on Monday, which is good news. But I want to remind people just to stay vigilant. There's still obviously concerns that if we don't, we'll take a few steps backwards, and the moving forward through those phases will be delayed. So just reminders to continue doing best practice. Wash your hands frequently throughout the day, 20 seconds. They're not recommending that anyone other than healthcare professionals wear gloves out in the community. And the reason is, if you have gloves on all day, you're really cross-contaminating if you're touching multiple things. Gloves are really meant for a one-touch job that you take off when you're done. So unfortunately, there's been some, guidance and suggestions about wearing gloves. My suggestion would be don't do it. Just, go where you need to go for essential items, use your hands, and then disinfect your hands before you get into your car. That's what we're doing. We disinfect our hands before we get in our private vehicle. So just a little FYI. And if you do use gloves, please don't throw them on the ground. There's a lot of that going on, unfortunately. Washing frequently touched items in your home at least once a day, especially if you are having helpers come in, people that help you shower, home health aides, nurses, physical therapy. If you have those services in your home, you should definitely be cleaning those frequently touched items when someone else is coming in the home, most especially. Cover your coughs and sneezes, of course. And then with the governor's reopening plan, there's still social distancing that will have to be continued, as well as wearing a face covering where you can't socially distance. I just wanted to make a comment about antibody testing. We've been getting a lot of calls from folks in the community asking where they can get antibody testings. So there are a couple of labs that are doing it. The unfortunate thing is the State Department of Public Health does not recommend doing that yet. They're not recognizing it as a distinguishing factor that you may have had the virus if you were never tested in the past. What happens is those results get reported to the local Board of Health. So we've received some reports that people have had antibody testing and the antibodies are showing a positive result. The unfortunate thing is if you haven't had another test to show that you've had the active virus, or you had a test and it was weeks ago and now you have an antibody test, the results say to the Department of Public Health that you could have been exposed in that 2 to 3 to 4 week period if you had a negative result. So the recommendation for us as a Board of Health is that anybody that comes back with positive antibodies, we have to put them in isolation just like you would if you had a positive nasal pharyngeal swab. So talk to your doctor. We're waiting as a local Board of Health for more guidance on this because it is confusing. As an example, I received an antibody testing on a resident who was a negative nasopharyngeal 2 weeks ago. The state looks at that as in that 2 weeks, this person could have been exposed and is now positive. So they have to go on to isolation. And the only way to come off of isolation is to then have that nasal swab done. So just a little aside, about that, because I think it's important. The testing isn't being recommended by the State Department of Public Health yet. I think down the road that will change. Keep updated with what the governor is talking about when there finally is standard testing for everyone to have the antibodies done if you've ever questioned that you had the virus or if you definitely have had it. The only other thing I wanted to mention about the testing and the virus, there is new guidance from the State Department of Public Health. If you are a direct contact of a positive case, if you've been identified in the contact tracing that we're doing and we call you, the recommendation is that you should get tested now. They had held off on that for quite a while because there hasn't been, the testing has been so limited at the beginning of all this, but now as there's more testing being done, anybody who has that close contact is being recommended to get tested. So we will reach out with that new recommendation. Thank you.
Thank you, Heather. Thanks for the update. Before you move on, something you said I wanted to just repeat. Are you saying that gloves, we're not recommending that people wear gloves? If we are, is there situations that you think it still makes sense to try to have gloves, or if someone feels like gloves are important, when's the most important time to actually use those? Because I know initially I was using them, and then it was creating more work for me to kind of figure out what to do with them and then how to wash my hands anyways. So now when I go to the grocery store, I just have hand sanitizer right next to my, sometimes I hide it behind my tire of my car and I just put it on before I even touch my car. So what are you saying about gloves?
So the unfortunate thing about gloves is they're really meant for that one task. So as a nurse, or a doctor, when you're using gloves, you're putting them on in a clean environment or a sterile environment. You're doing the task that you are set out to do that you need the gloves for, and then you take them off. The unfortunate thing about people using gloves, and I've seen this in the grocery store myself, someone will have their gloves on and they'll touch everything within the store, but they'll also touch their phone, their face, their child, they'll be in their purse. So that safety net that you think you have by having gloves on really isn't working if you're taking those gloves and touching everything else that you own, even opening your car door. If you just leave the gloves off, only bring in, and the only minimum thing that I bring into the grocery store when I go is my credit card. That's it. I don't bring a phone. I don't bring a list. I don't bring a pencil, with my little list to cross things off. I go in, I do my shopping. I don't try not to touch my face, obviously. And as soon as I get out, my credit card goes into, the pocket of my sweater or jacket so that I'm not touching it again, and I can disinfect that. But then I wash my hands before I get into my car so that I'm not, if you have gloves on and then you peel them off, that's fine when you get in your car. But think about what you've touched in that store with those gloves, that you've touched your purse, you've touched your face, you've touched your glasses. It's a false sense of security is really what the concern is.
Great. Well, thank you for clarifying that. Appreciate it. We have some questions rolling in, so hope you're ready for later in the program. We take some questions and answers. So our next guest speaker, actually she's not a guest speaker, she's practically a co-host, is Sharon Mercurio, the Director of the Council on Aging. Sharon, what's going on with Senior Center and the Council on Aging?
Well, good morning. Thank you for having me. So we haven't been able to have people at the Senior Center. The Senior Center has been closed. COA is still working. So we've been trying to bring the Senior Center to people's homes. ActonTV has been such a great resource for us. We have 3 different exercise classes that are available on ActonTV each day, line dancing, lectures. Java with John will be repeated several times throughout the week. So it's a great resource for folks if you're home. No excuse not to get moving or to feel like you're not getting the information. So tune into Acton TV. Acton Radio has also been a wonderful resource for us. This age, we're so technologically heavy. So if you're not on technology, there are still ways of you getting that information. The Acton Council on Aging is now on Facebook, so we try to put different photos, different suggestions, new programs that are coming up online or virtually. So please follow us on Facebook. And we've also been updating on online newsletter once a week. So my staff has been really busy trying to research what else is out there for people to do. So, go check our newsletter online. There's a lot of things that we're updating there. As we continue along with this, just wanted to remind people that the van is still working. The door-to-door van is available for urgent trips. So if you have a medical appointment or you need prescriptions or groceries, you can call the van service at 978-844-6809, and you can book a trip with them. Some other resources we'd like to remind people about is the Acton Food Pantry, great resource if you're in need of groceries. I know things are challenging right now. And again, everything's drive-through, so you're safe, you stay in your vehicle. Open Table in Maynard has been another wonderful resource for us. You can use their pantry. They also have meals. They give the Senior Center meals, so we have frozen meals available for folks. You just give us a call, and we'll either drop them off to you, or you can swing by and we'll put them in your trunk. The high school's been a wonderful resource. They have lunches. They're not just for school children. They're for anybody in the community. And again, Monday through Friday from 11:30 to 1, drive through and you get a free lunch. And I hear breakfast in the morning for the next day too. So not so bad. And Mount Calvary is still doing their community supper on Wednesdays from 5 to 6. And again, You stay in your car, you drive through the parking lot, and they'll pop the food in the trunk for you. So keep those in mind. Fuel assistance has been extended till the end of May. The state was aware that people's financial circumstances have changed. So if that's something you want to know the numbers, or if you qualify, please give us a call. The senior center's number is 978-929-6652, and we can connect with you and get you those services.
Thank you, Sharon. Any poetry in our future?
Yes, there is.
Okay, look forward to it. So our next guest is our town clerk, Eva, and the town clerk office has been very busy. As many of you know, there was an election scheduled for the end of March, which was rescheduled to June 2nd. And Eva and her team has been working nonstop to try to prepare for this June 2nd election. So Eva, what's going on? How you doing over there? Looks like you're in town hall. How's the action? Is there a lot of action in town hall today?
No, nothing today. Just the action in this office at this point. Good morning. Thank you for having me. A couple things I'd like to cover. As John mentioned, the municipal quarterly has gone out, and on the back of the municipal quarterly is the application if you want to send it back to us. And there's also been a mailing of cards like this. You can do that as well, mail it back to us. The applications can be either dropped off here in our Dropbox, or you can physically mail them to us, or you can email it. If you have access to scan it, you can email it to clerk@actonma.gov. We will take care of it and print it out and mail you the appropriate ballot or ballots that you will need. When you're returning them, you have the option of actually physically mailing them, or you can put them in the Dropbox. We check the Dropbox on a daily basis, and they'll be processed that way. As John mentioned, we have postponed our election to June 2nd. So on June 2nd, we are taking all the precautions necessary to make sure that any voters that come in and our workers are kept safe. We are doubling up tables, so when you come in to check in, you will have an extra table between you and the person doing the check-in. And we are making sure that everything is at a safe distance. We do have sanitizing products, so we will be wiping down any tables and the machine as people are going through. We are taking all the, like I said, the precautions that necessary to make sure that everyone is safe going through. We will make sure we mark on the floors the 6-foot distancing to make sure that everybody is kept at a safe distance. Thank you.
Great, Eva, and thanks for everything you're doing to get ready for this election. I have a question. If I'm voting, can I bring my own pen so I don't have to use the community pen?
Great question. Yes, we actually would like to encourage voters to bring their own pen. The only thing that our machines won't read is like a highlighter or anything red. It'll take a pencil, it'll take a blue pen, black pen. We will provide voters with a pencil as well. We send out golf pencils with absentees years ago, so we're starting to bring that back. We do have a supply of those, so if you didn't bring one, those are available, and those you can just discard after you use it. It's a one-person use and you're done.
Or you can use it when you play golf.
Absolutely, yes.
So BYOP, bring your own pen or pencil. Other questions that I know I've seen are the state and the Board of Health actually has a local mask order. So my understanding is if this election is being held in a public building, which it is, the Board of Health's order is that masks shall be worn if social distancing cannot be maintained. So that's something that I think it's important for voters to know, is that according to the Board of Health order, and they may clarify it before June 2nd, but it appears that masks need to be worn during the election for voters and staff.
Yes, we will be sending out to all our staff notices saying that they do have to have a mask that they have to wear all day long. We do have some masks that we can provide for our workers to make sure that they stay safe. But yes, we encourage every voter that comes into the polling location to actually wear a mask. And also, in addition, I'd like to make sure that all voters are aware of the fact that the polling location has changed to just the R.J. Gray Junior High for all precincts for just the June 2nd election.
So everyone that wants to vote has to go to the junior high, or they can use the mail-in process. So if people are just finding out about this right now and the election is June 2nd, what's sort of your deadline for people to get their applications into you to make sure they can get a ballot back in time?
Obviously, the sooner the better. We are processing them every day. So if you send us a ballot, we need, we mail it out the same day or the next morning, depending on when the mail comes through. You want to make sure you have all those applications in as soon as possible. We have to mail the ballot to you. You can return it, physically return it to the town hall and drop it in the drop box. But we have to have it back by election day, 8 p.m. on election day.
Great, thank you. So I think it's worth just clarifying for people. It's a two-step process. You don't just send this in. You have to actually send this in, and then the town clerk actually has to send you back your ballots. You get your ballots, and you have to return your ballots before June 2nd. So to complete that two-step process, I'd encourage everybody to do it today or next week, to make sure that we have time to get the ballot back to you and you have time to get it back to us before June 2nd. So do it as soon as you're able to. And if you have questions about this, is there a number? Well, we have this is a good time to mention our town services hotline. So as you can see, Eva's in town hall. Some offices have staff there every day, some don't. But it's important for us to make sure that when you call looking for help, you have someone answer the phone. So we've set up a town services hotline, 978-929-6619. And that number, if you call during town hall business hours, you always get a person. We also have translation services available at that number if someone needs help with a second language. So that's a number that I recommend you call if you're looking for somebody. So if you have questions, please call that about the election process. And thank you, Eva, for all the information. Any other updates from the town clerk's office that you want to share? Anything else coming up? Town meeting, I guess, would be one thing, but we're still working on that.
Well, that's correct. Town meeting it's still in the works. I know I spoke with John and the moderator this morning. John will get more information out to everybody. Nothing has been finalized. We need to get other boards and committees on board to make sure we have information that is accurate to go out to the public. We do have other items that come through the town clerk's office. We have vital records that come through. We are trying to get as much of that done as possible. We do have an online request and payment on our town website. You can actually process it through there, and we'll get it back to you as soon as possible. We'll physically mail them to you.
Great. Well, thank you very much. And hopefully you can stick around for a few questions. They've started to roll in. So thank you, Eva. And good luck with all your preparations for the big election on June 2nd. So I guess now is the point in the program where we'll start answering questions that we get in from the public. Our first question is from an email writer. Can signage be added to rail trails indicating that walkers, runners, and bikers should all be wearing masks on the trail? Heather, I know you've been following the Board of Health discussions on that. Any comment on that? I mean, I know that we have added signage in several of our open spaces and trails, and we've done the best we can to try to notify people of the social distancing and the masking requirement. So I believe we already have added signs, but is there anything else that you want to add to that, Heather?
No, as you said, I believe we added signs already. I think there's also some of the message boards. I know there was one there at a certain point. I don't honestly know if it's still there, but there has been signage at the entrance to the rail trails wherever we could place them. I do know that the Conservation Department had put those out a few weeks ago based on a request.
Yes, so thank you. That's a good question. It's something that I know the Board of Health talks about every week is people out and about and whether or not they're wearing masks, and we're doing everything we can to enforce that rule. So thank you for the question. Second question is, as a caregiver, is there a possibility of the CVS on Mass Ave having a drive-through set up for pharmacy? So that's something that I know the Board of Selectmen talked about briefly. Drive-throughs are not permitted in town as of today, given our zoning bylaws. There has been discussion about looking at that at a future town meeting. So that has already been addressed. I think in terms of a temporary situation, that has not been brought up at this point. Heather, do you have anything on that?
No, I haven't. That's the first time I've heard that question, honestly, about the drive-through pharmacy needs. So I haven't heard anything on the Board of Health about that discussed, unfortunately.
Okay, and then the governor announced yesterday a bunch of CVSs across the state are designated as testing sites. Are we aware of any in Acton that are testing sites?
No, the CVS is in Acton, so CVS is doing those sites independently. There are quite a few that are local. There is one in Lowell that has been up and running for, gosh, at least 6 weeks. The new locations are Charlton, Worcester, Raynham, Northampton, Bridgewater, Carver, Springfield, Danvers, and Westport. I also know there was one initially at the get-go in Shrewsbury. Foxborough is another location where they're doing testing, but it's really the CVS company that is deciding where those locations are, is my understanding.
Okay, yeah, maybe we can publish some of that information about the latest testing. I know the state has it on their website, but maybe we can add that to ours tonight or next week.
Sure.
Here's a question for Eva. From YouTube, a YouTube questioner. How many completed ballots have come in so far? Let me oh, go ahead.
All set. I would probably have to guess at this point. I have not physically counted them. I would tend to say maybe 600-ish have come back.
But what's a normal turnout for a local election? Well, this is a special state election and a local election. So is there any way to know the local turnout estimates? Or?
Sure. Local elections, we usually get about 100 to 200, depending on what's on the ballot. If it's just the committees and that are on there without any questions, it's usually an average of 100 to 200. And those are usually the ones that are permanent absentee voters, anyone in the nursing home or the elderly that don't want to go into the schools. But this, obviously, there's a big push for early voting, so which is great. And I think that's why we're getting so many right now.
Wait, when you say 1 to 200, you mean 1 to 200 absentee ballots, not votes cast. What's the general turnout in actual votes? How many people is it? A couple thousand, right?
Yeah.
Okay.
Yeah.
So we think that there's still plenty of people that haven't sent in their ballots yet.
That's correct. Yes.
Okay. Well, hopefully people are seeing this and they understand how to do it. If there are any questions, please call us. But please send in your applications to get your ballots and have them back to Eva by June 2nd. So here's another question. Oh, so this actually is a question about our reporting. So every day on our website, we do a report on the COVID response, and we include number of cases, and we include other timely updates. Starting last night, we've changed how we do reporting. There's been a lot of concern in the community about people and how they're handling this COVID-19 and whether or not they're recovering. And up until now, we haven't been reporting on people that we've tragically lost to this terrible virus. But starting last night, we are reporting that information. And the reason for that is that we were trying to protect privacy of people and not have it be too easy to identify cases that tragically resulted in fatality. But we're at a point now where we think we've gotten a lot of questions about why aren't we producing this information. So we're starting to do it as of last night. So I'll just read what we put out last night in case you didn't get a chance to read it. So we said, as of this time, there are 144 cumulative cases of COVID-19. So the 144 cases have been known to us of cases of COVID-19. 76 of those are currently people that we're monitoring, and they're currently isolating themselves. 59 of those are cases that have already been recovered. And tragically, 9 of those resulted in a fatality. So it's something that is very sad, and I think it may be shocking for some people to hear that, but given what we're dealing with, we think it's important for that information to be provided. So that's our update on that. Let me see other questions that have come in. I think I saw one more. Oh, here's one for Sharon. Sharon, how many Facebook followers do you have, or Facebook likes? And what's your goal? How can we get them up for you? Do you want to do a promo?
I did a PSA this week on the radio, so hopefully we'll get some folks from there. I think honestly the best way is word of mouth. You know, if you found our Facebook page and you enjoy it, you know, let your friends know. It's really easy to find. So Acton Council on Aging, Senior Center will bring you there. At this point, I haven't checked today, but earlier in the week we had between 30 and 40 followers. So
all right, we got to get that number up in the hundreds. So let's work on that. Well, actually, that's a good segue to something that we started doing. We have a dynamic group of employees that are called the Social Media Working Group, and they're working all the time to try to produce content for several of our social media channels. And as of last week, they started producing a weekly program called Acton at a Glance. And it's just a 1 or 2 minute thing where they talk about some things that are happening right now and things that you may have missed on social media in some of our other accounts. Hopefully you get a chance to check it out. We posted it yesterday on Facebook, Instagram, and Twitter. Yesterday, they highlighted some great things that we're doing over at the library to provide distance culture, I guess you would say. We also highlighted the fire department. They have a new Instagram account where they're posting almost every day, public service announcements and incidents and things like that. So we're excited to have them enter the world of social media. And there's also an advisory on how to properly wear a mask. And every week they'll be bringing you sort of snippets of things that are happening just to make sure that everybody sees the great work that our organization is doing on a weekly basis. So thank you to the Social Media Working Group. And I think we're at the point of the program where we're wrapping up. We had some great questions, some great guests, and we like to end the Job with John program with a little poetry. And our poet laureate, at least on this program, is Sharon Mercurio. And we're looking forward to seeing what you have for us today, Sharon.
Okay. So untitled poem by E.H. The thing about pain is it won't last forever. And it kills you right now, but with time it gets better. The thing about scars is they all start to fade until nothing is left of the cuts that were made. The thing about today is there's always tomorrow. And if you can't find your smile, I have one you can borrow. The thing about help is it stands beside you. It won't know it's needed unless you reach out your hand. The thing about love is you can't feel its touch until you let someone know that this world is too much. Thanks.
Beautiful. Thank you. Great work, everybody. This has been Travel with John, May 15th. I want to thank our guests. I want to thank our help that you don't see on camera, Mark Hald, Matt Frost, Mark Ducey, Austin Saganowitz. They're all doing a great job producing this stuff behind the scenes, so thank you. And everybody stay safe and have a great weekend.